Our goal is to close that health literacy gap because we know that many communities, they struggle with understanding some health terminologies, which directly affects their ability to navigate healthcare systems. And HealthWhiz is there to simplify these complex terms and make health knowledge accessible to all. When it comes to health literacy, it's kind of in three parts. One, sort of the awareness, right? So as Tosi mentioned with the recall example, you hear it, you know what it is, right? That's one part of the literacy. The second part is the actual knowledge. What does recall mean? Recall means I should go to my fridge, check if it's, the expiration date or where it's from, and I should toss it. And then the third part of literacy being application, right? So telling my neighbors down the street that we go to the same grocery store at, like, hey, they just recalled every, can of butter in this store. Health literacy, I'd say it's in three parts. And where HealthWhiz comes in is that under that sort of recalling it, right? Knowing it, the definition, and then the application stage is what put the onus on our players to do.
Hey friends, welcome to Public Health Careers. I'm Omari Richins, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Tobi Dare and Tosin Ogunsola. Today's episode is special. We're joined by two amazing public health professionals and co-founders of the HealthWhiz, an educational card game that brings public health concepts to life through play and community engagement. Tobi is a public health strategist with deep experience in program management, quality improvement, and international development. She has worked with organizations like the CDC, Monarchs International, and is presently with the National Association of Community Health Centers. Tosin is an epidemiologist and infection control expert with a strong background in COVID-19 mitigation, outbreak investigations, and regulatory compliance. She has served in key roles at the Virginia Department of Health and is currently working deeply on the HealthWhiz. Together, they've fused their creativity and public health expertise to build the HealthWhiz. And today, we'll explore how they're using play as a pathway to health literacy. In today's episode, you'll hear and learn more about how the HealthWhiz game was inspired by the need for better public health communications during the pandemic, how the HealthWhiz aims to simplify and gamify complex health concepts for broader understanding and better health literacy, why knowing your why is essential in maintaining motivation in public health, understanding the public skepticism is essential for effective health communication, knowing why the importance of health literacy, especially around making informed health decisions, and why experiences in the field provide invaluable lessons beyond academic preparations, and much, much more. Hey y'all, I almost forgot. We're doing a HealthWhiz game giveaway. To enter, here's what you need to do. You have to be following both accounts, the Public Health Millennial and the HealthWhiz game, on Instagram. They're both linked below. And fill out the quick entry form linked below, and you'll be entered in a chance to win. That's it. We'll pick a winner from the raffle, but remember, if you're not following both accounts, you won't be eligible to win. So follow both. Good luck, and I can't wait to see who takes home a copy of the HealthWhiz. Enjoy today's episode.
Hello, everyone. My name is Tobi. And my name is Tosin. We are the co-founders of HealthWhiz, and you are listening to Public Health Careers.
Tosin and Tobi, welcome to the show.
Thank you. Thank you.
I'm super, super excited to learn more about the process that got you all towards the HealthWhiz. I do have a box right here. It is a game, and we'll talk a little bit more about that. I'm looking forward to hearing more about your journeys as well. But before we do any of that, we'd love to hear, how do you all identify, and tell us a little about your personal background?
I'll start us off. So I am a Nigerian-born woman. I currently reside in Maryland. A little bit about my background, it's in international relations, but also public health. That's kind of where Tosi and I met when we were getting our master's in public health in the DC area at GW School of Public Health. And I'm currently working in the field now as a program manager. So that's about me.
I'll throw it to you, Tos.
Yes, so my name is Tosin. Yes, I am originally from Nigeria as well, and I currently live in Alexandria, Virginia. And I'm currently like not working and focused on our game and trying to like get it started or moving. I used to work as an epidemiologist with the Alexandria Health Department, and I help with anything infection control, disease prevention, and all of that. So my expertise is still in public health. Yes. Um, when I'm not working, I enjoy traveling and reading and spending time with families and friends. Yes.
Well, I appreciate you sharing that, and I love that you're able to transform like your passions for public health and take that to create this board game. So as I was sharing, it's called HealthWhiz. It's in my hand right here in this box. So what inspired you all to create the HealthWhiz?
I love this story. So as I mentioned, Tosi and I met getting our masters at GW, and we got out in May 2020, which, if everyone can remember, that was the peak of COVID, right? So I don't know if I should say luckily or unluckily for us, Tosi and I were both employed at CDC during that time and also with Virginia Department of Health. So in those roles, we really got to speak to the community. We got to speak with people that were either suspected cases of COVID, had it, or exposed, etc. And everyone was learning during that time. We were learning, you know, how many boosters are needed. We were learning how does a quarantine differ from isolation. So at the same time that the public health community was learning these things, so was the community that we were speaking to. And we learned and observed during that time that certain terms, certain behaviors, certain requirements were just confusing to people, right? And even as we continued in our public health journey, there's some things that we just know. We know what a vaccine is, right? We know what MMR stands for. We know that PCP just means your doctor. But we wanted to really communicate that to people that are not in the field, right? Because we believe that, it's necessary to take ownership of your health, to know things as well that pertain to your well-being. So it was from those experiences working with the community that we thought to create a tool or a fun just experience with HealthWhiz, the game.
And I'm just curious how you went from tool to actually building out a board game. Like, I could imagine that the community were at the point in time with the pandemic was learning or trying to learn and understand a lot of what was going on. And many people out there were doing health education, were creating tools, but many of us have not created a board game. So what was that process going from conversations to board game?
I would say, well, at least the first thing was that we both love games. Toby loves playing game, and that was one of the things. And I remember we just sat down and said, this would be a good way, people can learn or they can play games while learning. And we could introduce all of these challenging terms. And we know that gamification can turn like any intimidating health concept into something interactive and playful. And we just thought that the way to go would be to like make it a actual physical card game instead of passively receiving information. The board game is to create like an active participation, like people having the opportunity to answer questions, collaborating, or even competing, which was all like part of it. Something like you can be at the game night not knowing and you're still learning something. Or you could be in the classroom after hours and playing out with and still, I mean, it doesn't give, it's not a structure, which we had that in mind. We don't want you to feel like you're in school or it's a lecture or anything. It's not that complicated. The goal was just to make health fun. And we just chose that approach.
Yeah. To add to what Toasting captured it perfectly, as you mentioned, Omar, during that time, maybe CDC and Co were coming out with like worksheets or posters. But if you think back, people were once again like quarantining inside. Board games is a perfect way to bring them together. So what initially started out is, okay, we just made hundreds of words, right, that came to mind. So it went from an Excel sheet of words to then we categorized the words. Then from the categorizations, we made them different names instead of just saying diseases, right, or food. We made them, sort of trendy. We developed a logo, developed a box format. All those things were along the timeline, but it did start off as just like sort of a database of words and grew from there.
Yeah.
And how do you all see, because you spoke about the importance of like gamification in your thought process and building out this game, and I guess to a larger extent in educating people and making it more of a active activity as opposed to something that's passive. So how do you all see gamification helping public health education and engagement overall?
Tosin has a background in education a little bit, so I'm going to let her take this one.
I would say that I guess to add to what I was saying, it would a good example. It would help to help players navigate or to be, like I said, the goal is to make it less complex. So we're still sticking to facts. We're still like it's still like the define what you already know, what's already out there, but we're bringing it in more like simplified ways and making it more active. For example, like a player might recall like the definition of, let's say, herd immunity or immunocompromised or pandemic, for example. We had words like COVID-19 or the difference between like a virus or a bacteria because, you associate it with a fun moment during the game. So we're thinking that gamifying this else words or concepts would help improve public health knowledge or literacy in a way that when you know this, you're more likely the way you would take news or you would have like more of a positive impact around yourself, around your communities or your friends, and you can make informed decisions with your knowledge.
Yeah, I appreciate that, and I think like at this point in time that like I feel the conversation on public health and like the larger dialogue that is happening at the moment, we know how important it is. I feel like people are scared of things that they don't know, and in order to get people to not be scared of things is to explain and share information with them, and games are good ways to break those maybe like silos and allow people to kind of understand topics from a new lens, which I think is so important in today's landscape, and just creating ways to have conversation around things. And we'll get more into maybe like the format of the game, but what has been the response from educators and from students and from people that you all have interacted with who have played the game so far?
Yeah. I think overwhelmingly the response has been really positive, and we have been surprised since releasing it last year. One, the game is sort of it's written for 12 plus, just for a specific section, but we've had children as young as 10 play it and play it well. We've also had people that are in the field, clinicians play it, and also people that they're just interested in games, right? So the breadth of the audience has really surprised us. And then as well as playing with, as I mentioned, students, the breadth of the audience has been one overwhelmingly positive and wider than we had anticipated.
Yeah. And we've gone to like tabling events, like back to school. And I think that educators, from the few reviews that we've gotten, they found it helpful while they're playing it at the table, because when we do like a display or like to show how it's played and how they can use it in the classroom, and then they find it to be adapted or adaptable for classrooms after school programs, even community workshops, because it kind of allows them to spark, like it sparks a discussion or a conversation, or like it's like a conversation starter. Like if you don't know something, you talk about it, or you keep wondering like, oh, what is this? While you're actually reinforcing all of these terms. So you might not be taking it as a class or anything. It's not a lecture. You don't have to read it in book, but it's like simple words that you come across during the game. And the response has been like really positive um, from both educators and student as well. Like the student that have played it, or 12 years old, was the youngest that has, I think a 10-year-old has played the game. Yeah. And
Yeah.
it depends on the category. If you go and like prevent and cure, they tend to know all of that. But when it comes to other categories like organizations and influencers, which you will see, it's more technical and talking about organizations. So you can see in the age gap that, okay, 10-year-old might not know all of this, but they might know this. But it's been pretty positive feedback, and which we're thankful for, because that's one of our, I guess, as co-founders, that's something you worry or at the back of your mind, like, is this serving the purpose that we wanted to serve? But we're glad that we're getting there.
Yeah, absolutely, and I think it's helpful for me as well, because I've had the game in hand. I've looked at it. I've played it a little bit with my girlfriend who's also in public health. So I think it's like and some of the things definitely are difficult. I would say that, but it's good to hear like the overall like aim and goal isn't necessarily like for public health people. It's for like everyone in general, the lay person, so that it maybe like creates more of a sense of like health literacy and public health knowledge, and maybe even gives people the ability and strength to maybe be more comfortable and advocate and speak up for themselves in public health and healthcare settings broadly. So this is awesome. I would like for you all to share like more about the format of the game. How I think of it is like kind of like it's like taboo with like two styles of like this guess kind of cards and like definition type cards. Let me know if that's how you all would explain it, or how what is the format of the game for people that might be interested.
Sure. So we don't say taboo for legal purposes, but
Fair enough.
as a reference like that. So it's 200 words, non-exhaustive. It's spread across 6 different categories. So first category being planet and the plate. That's where we have our words on food and the environment. Second category being organizations and influencers. That's where we have words such as public health careers, so doctor, or you may see Fauci there, for example. We have mind and body wellness, which is our mental and sexual health category, which is the one that's a little bit mature. We have prevent and cure, it's a crowd favorite, and that's where you see things such as a Band-Aid or, ointment or toothbrush. We have body battles and bugs, which is our category for infectious diseases and chronic diseases as well. So you'll see malaria, you'll see heart disease. And then finally, we have our public health 101 category. That's where we have what we believe, and I'll add as well, but there was a period in the development phase where we did sort of do focus groups and tested with people to see which words would go where. So Public Health 101 is where you'll see things such as pandemic or I mean, it's not a simple one, but epidemiology. So that's 200 words across 6 categories. And I'll let Tosin explain the 2 types of cards we have as well within the game.
Yeah, so we have the definition and the sentence style, the definition and the guessing. So for the guessing, which is why you mentioned, I guess that's why you mentioned taboo, but it's not. For the guessing, you just make sure I don't know if you have the card, you make sure that the main word, that's what your team should be getting. I should be guessing. And you have to make sure that you're not mentioning any. Yes, exactly. So family planning is what I want my team to guess. But while I'm describing that, I also know that I can't say any of the 4 words listed below. I can't say decision, children, couple, or sex, I have to find more creative ways to describe family planning without really saying it. And for the definition, that actually is just like plainly just giving you definitions for what the actual word is. And when you're playing that, you read the sentence and your team or whoever you're playing it with has to guess what that is. And we're doing it by points. So you can actually make the game your own. You can, I say, maybe customize. You can make it your own, really. Create more rules, make it more difficult. But we just gave a standard guide to help, like, you just want to play basically. Yes, the guide is there. For every point every card you get right, you get a point. That way you can decide who wins the game or not. What else am I missing? I think that's it. Yes.
No, I appreciate that. I appreciate that. And yeah, I definitely do see these similarities in the games, as well as like I do think it's good that we are creating like new avenues or like other avenues for people to engage with health, with public health, and really to build maybe even like some of that health literacy. So considering that, like, what does health literacy mean to you all, and how do you think the HealthWhiz helps move those needs?
Did you say health literacy or health equity?
Health literacy, yeah.
Literacy. If you want to tie both in, feel free to do that as well.
To me, health literacy is it's when the individuals have the ability, or they have the tools that they need to make like informed decision about their health or anything else related. Like when you're going to the doctor or whatever health related stuff you're trying to do, you have some knowledge at least that way, or you have access to it. Yes. And I think that everybody has or deserve, or should I say, they should have that opportunity or like a fair chance um, to have health literacy, like have access to it, regardless of their background, income, or education, or their environment. And I think a game like HealthWhiz that we create, it also helps like in breaking down all of the barriers that's um, like limited access to reliable information or healthcare services. Like when you are literate, or should I say, yes, when you are literate in health, you have a higher chance of asking questions because you know what this is. Yeah. Like if you played HealthWhiz, for example, and you saw epidemiologist and you heard about it, or you see on the news, you see a recall or something like that, you don't need to go to school. You're like, oh, I know what recall is. Like maybe the FDA recalled the yogurt in your fridge or something, some products that you use at home. You could be 15, 16, 20. You don't need to go to like a public health school or be like any one of us on this podcast to know that. And I think that we goal is to like close that health literacy gap, right, Toby? Because we know that many communities, they struggle with understanding some health terminologies, which directly affects their ability to navigate healthcare systems. And we HealthWhiz is there to simplify this complex terms and just make health knowledge accessible to all in any way. So I feel like we're able to combine, yes, you should have this so that you can be better. Yeah. Toby, do you have anything to
No,
add?
I think you captured everything very well. My thought as well when it comes to health literacy, it's kind of in three parts. One, sort of the awareness, right? So as Tosi mentioned with the recall example, you hear it, you know what it is, right? That's one part of the literacy. The second part is the actual knowledge. What does recall mean? Recall means I should go to my fridge, check if it's, the expiration date or where it's from, and I should toss it. And then the third part of literacy being application, right? So telling my neighbors down the street that we go to the same grocery store at, like, hey, they just recalled every can of butter in this store. So health literacy, I'd say it's in three parts. And where HealthWhiz comes in is that under that sort of uh, recalling it, right, knowing it, the definition, and then the application stage is what we would put the onus on our players to do. And sort of with the two styles of playing as well, we have the definition on the cards, but if you have a personal experience and you're playing with your team members, you can also use that and they'll then make the connection between those words. Yeah.
Well, I appreciate you sharing that and like creating this as an avenue to build more skills or confidence in health literacy for people in public health, people outside of public health. How are you all thinking of expanding the Health Whiz to reach even more communities and even more people?
Yeah. So, I mean, we definitely think HealthWhiz still has a long way to go as far as reaching, even our sort of, target audience, so to speak. So that being students, families, adults, children, as Tosi mentioned earlier, could be used, in icebreaker settings. So we are still sort of on that journey of spread and getting more attention to it. Recently, also somebody suggested if we had looked into the senior citizen community as a possible population that could play the game. So we're also sort of exploring that avenue. But it's August as we're doing this podcast now, which means it's a great opportunity for Tosi and I to sort of maybe go into schools to demo, put some funds into marketing as well. So we are still in that sort of we've launched, but in that spread phase to get target eyes on it, especially as you mentioned, Omari, earlier with the climate of what's going on, right? There's for example, being new definitions being applied to what SNAP benefits can cover, right? So people have to pay more attention to maybe nutrition labels in the coming weeks and months. So it's definitely that sort of spread phase for us now to get more attention and eyes on HealthWhiz.
Yeah, well, I appreciate that, and I guess I'm glad to be part of some of that push to help you all in getting it out to more people as well. And before we transition a little bit more to some of your like academic pathways and paths into public health, would love to know like what does public health mean to each of you?
To me, it means everything. I believe that the one great or one of the tenets of public health is that it's not restrictive, right? Not restrictive to just clinical, not restrictive to just nutrition. It's I won't say it's everything, but it's everything pertaining to our well-being. So public health to me means that assuring that each of us as individuals has, safe environment, safe food. We are informed about how to, maintain the health of our bodies as well. So it's both personal health as well as sort of the social drivers of health around us that all flow into what public health is.
Yeah, I agree with your thoughts. To me, it's also like it's about protecting, improving the health of people, you know,
Sure.
communities before they're even sick. Because the system right now seems to be mainly, or the booming part is always about like treating, but we don't want to spend money and prevention, so we need to be able to do that. So from my, I guess, perspective, also working in the health department, it's just like it's very important that we make sure that we're protecting people before like illness or anything like that. I think public health also is the bridge between the science and society, when we kind of use data, we use education, policies to create, environment where people can actually like live a good and healthy life. Public health looks into like root causes, which we have why we have like local health departments and all of that. It addresses like disparities, because if we don't have public health, like no one is going to know whether one race or the other has a shortage of, it's not getting what they need or anything like that. So I think our public health also builds system that everybody as a fair chance at a good health.
And sticking with you, Tosin. So you got your bachelor's in psychology from Montclair State University. What influenced your decision to study psychology?
That's a long time ago. Okay, not too long. I would say influence more like I was like every other undergrad, trying to like navigate life and career, what I wanted to do. And I ended up in psychology because I took psychology 101, a psych class, and it was just interesting to me. And I was just like, I could do this. I want to know more about it. So it's always about like being interested in understanding like why people think this way, how we feel and hacks and the way we do things, how our environment shapes our health and all of that. Psychology just gave me that, foundation to explore like questions and to build like my skills and critical thinking, empathy and communication. I just love it. So I did psychology. It works for me. Wow. Yes, the grad. Yeah.
Yeah, I appreciate that. Yeah, I think it is many times a journey of discovery in undergrad and then kind of like digging into some of our interests. Are there any takeaways from your undergrad experience you wanted to share?
I would say takeaways would be okay, one major takeaway would be like recognizing how much people's decisions are shaped by their environment or access to resources and even their mental well-being. I also like learned the importance of like actively listening and empathy, understanding people's perspective can influence like a positive change. So I think mainly that's a major takeaway for me in my psychology background.
Yeah, yeah. That makes sense, and I feel like those are like tangible takeaways that you're able to experience there. And you continued on to get your Masters of Public Health in Global Environmental Health at GW University. So, what drew you into public health and into that specific track?
It's also another like me trying to navigate because I knew I wanted to work in the healthcare space. I just didn't know particularly which way to like go into quickly. So there's different factors. And at that time I chose my track because I was interested about the link between the environment and health and equity, we're able to like track how the climate affects our health, the air that we breathe, the water, any other occupational like exposures. Those were the things that I knew about the environment and wanted to like learn more about how it affects us or affects vulnerable populations. So I combined my interest in all of this, and I just thought the right approach would just be to go into it and just yeah get on the track.
And how do you think that prepared you for your public health work after your degree?
Yes, it did prepare me, but the real lessons actually that's how I got out of public health was actually when I started working in it. When it came to actually but the preparation that at least the program gave me, I would say, is just to learn or know the systems level view of health. And this kind of equipped me with the skills in epidemiology, risk assessment, program evaluations. Um, the program also like at least helped me to translate like complex sciences. You're able to like read an article and digest it and break it down and make it and create a more practical guidance, you know all of which has been like critical in my work too as an epidemiologist at the health department, also which contributed to us creating this game too. the program prepared me for what I'm currently like doing. Yeah.
Yeah, I completely understand that. And I think many of us can relate to feeling like, yes, the program did prepare us in some extents, but then actually getting into the workforce and saying like, oh, this is the actual work and this is the
Yeah.
actual learning and this is the
It's,
curve that it takes to be in public health.
yeah. It's like giving like a little template or a taste of it. This is
Mhm.
what you will be or might be working on when you get out there. So you have it, and yeah, it helps.
Absolutely, absolutely. And I'm glad it led you to where you are today. So switching across to Toby. You, on the other hand, got your bachelor's in international relations from Syracuse University. What led you down that path? And yeah, just tell us more about your undergrad experience.
Sure. So I love Syracuse. It was an amazing 4 years for me, amazing developmental years. I've always loved travel. As I mentioned, was born in Nigeria. I was very much living in a CNN household. So I love the news and history. So that's what led me to international relations. And yeah, that was public health wasn't the original goal when I started with IR. Maybe I thought I would be a diplomat at some point, but yeah, I was a CNN kid, so that's what led me to IR at the Q's.
What you laughing at, Tosin?
Just a CNN, and I could see it.
Love it, love it. And what were some of like those key experiences or takeaways that you hold from your international relations degree to
Yeah.
today?
Yeah, so I was privileged to be a part of the Model United Nations team for
Mhm.
2 years while at Q. So we were able to do conferences in New York and DC. And basically with MUN, you get to, your school represents a country, and then within that country, you represent an agency. So USAID or, particularly UN, sorry, oops.
United Nations.
UNCF, for
Oh, okay.
example, which is different agencies within the UN body. So that would be a semester or two of really understanding the country, writing papers, all before ChatGPT, I might add. And public speaking as well. Public speaking is a skill I definitely gained specifically from, I can point to the IR program for developing within me. And notably, my senior year, my capstone project was on public health and nuclear development in sub-Saharan African countries. And that's sort of where the public health connection was made, right? I was put into this capstone course that was about nuclear arms. I was like getting into health at that point, and I was wondering where the two could connect. And in certain sub-Saharan African countries, that produce uranium, so they mine uranium to fuel nuclear arms, there's, of course, health risks of exposure. And I found that countries like Australia that were mining they had these health guardrails in place. Meanwhile, other countries, Namibia, South Africa, things were more lax. And what does that mean? Pollution. Um, and I just saw that sort of imbalance, and that sort of led me to the program at GW.
Okay, so you got your MPH in global health program design, monitoring, and evaluation at GW. Were there any other inspirations that led you to say, okay, I'm going to do an MPH, or was that like that discovery in like that? I don't know if you said it's a capstone, but like that project, was that something that was like, okay, I need to learn more about this and I'm going to get a public health degree?
Definitely. I think one, just wanting to go after higher education, and two, that capstone, knowing that with a master's in hand, I could really delve more deep into what I saw as that imbalance, right? So with program design, when you design programs, you're meant to design guardrails, protections for workers, for example, occupational health. You're meant to monitor, you're meant to evaluate. And it's meant to be a cyclical thing so that health can improve ultimately. So I specifically picked our school for that concentration, which spoke to me.
And what were some of those takeaways or key insights that you were able to gain throughout your time there?
Yeah. I think key insights definitely were the interconnectedness of things. Tosin kind of mentioned it in her definition of public health earlier, how public health is systems, it's surveillance. And for those things to be successful, it takes lots of working together in different fields. So that was one big takeaway, as well as something that we did. Tosin also touched on it. I'm sort of taking those really high academic papers and not watering them down, but really gaining a good understanding of them to apply to day-to-day life.
Yeah, absolutely. Absolutely. Well, I'm glad that you were able to meet at that point in time and continue to collaborate and stay connected to build out the Health Whiz. So shifting back to Tosin and into like professional roles. So you had some research roles at the Climate Media Lab and the Virginia Department of Health. I would like to tell us a little bit about the roles that you were able to do there.
Um, so it's been like transitioning into from one role to the other. But most of my work or important work, all of the works were important. But my role as an epidemiologist at the Alexandria Health Department involves like some of my daily tasks will involve investigating outbreaks, monitoring disease trends, providing infection control guidance to long-term care facilities, shelters, detention center, congregate settings, healthcare congregate settings, just within the vicinity of the Alexandria Health Department. I also review case data, like coordinate with healthcare providers, whether they're out of the county, out of the city, or with other health department, Fairfax, Loudoun Health Department, you name it. Anything that really relates to disease monitoring or trends, we communicate that between each other. Um, Also, the prevention response. Yeah, a big part of my role is mostly just translating public health data into like actionable steps that help prevent or protect vulnerable people, I would say, within the population, and also helping strengthening the community through preparedness, and also like getting the community the information that they need to make. So a good example of that would be that um, if there was any illnesses or diseases going on around, then it's not public information. The news does not carry that, but through other health agencies that we partner with, whether it's the CDC, we get those kind of information. We tune in on routine calls, and when we know this information, we break it down into more simpler way for the community to understand, and we spread the words. So it's almost like a town career kind of role. It's like, this is going on, and then we break it down. Then we also spread the news within the city of Alexandria. So that was what my work at the health departments kind of looks like. And I really enjoy doing that. Yes.
And you shared just a little while ago that like a lot of your learning experience came when you were in the working world. What did you have to learn to become an effective professional?
I just love to learn. So there's always like just actively just getting useful information, or there were also like trainings or seminars and webinars online that just helped me or in my work to like make me better, and also like be updated on whatever the latest guidance was or the latest work was. And while working, I would say, especially during COVID, it just I guess it showed me both the resilience, of public health work first, we're able to like adapt and like just stay committed. It's mostly like what drives me is that knowing that the work I do has positive impact on the community. We're like making changes. We're helping the community get better. We're giving someone or some people or some family, some community the information that they need um, to be the best that they can. Um, yeah.
Yeah, that makes sense. I feel like many of us in public health and health saving work are driven by being able to make positive impact on people, communities, and that's one of the reasons I thoroughly enjoy and I guess embedded myself into public health at this moment is the ability to have that positive impact on not just people but like larger communities, and as well as like understanding, like to your point earlier, how do we shape environments and systems to better help and support people live their best lives. Shifting over to Tobi now. So you had internships with, I don't know if it's WI here or We Here and the American Red Cross. Would you like to speak about those?
I'll speak about interning with Her. That was a stint with them. They were actually working on an obstetric fistula project, interestingly enough, in Nigeria. So that opportunity was really, I'm not sure if I even this word right, but a novelty. It was a new experience for me because I previously hadn't really specialized in maternal and child health projects, but that was a period of learning about the burden of obstetric fistula on women. That's just when women are in prolonged labor, typically sometimes happens when they're younger women. And then once they have that prolonged labor, they become discontinent, meaning basically they're leaking fluids. So that is a huge burden, but I didn't know was even affecting my country, Nigeria. And what YHER was doing during my time with them was creating sort of a convening meeting with actors or stakeholders, I like to say, in northern Nigeria that were working to do obstetric fistula surgery or outreach. And it was really an emotional experience for me. One, to learn about it. Two, to really see how, okay, I'm Nigerian, but I'm also American. And there's things that both countries can learn from each other as far as how to prevent, treat, control this huge burden that women don't just face in Nigeria, but also face here from time to time. So that was a very important internship for me during my MPH program, actually.
And you've also had roles with the CDC, Red Nail Labs, Chemonics, and most recently NACHC. Feel free to speak about any or all of these. And as always, people listening to this, feel free to reach out to the guests and get more information about what they did in the role in a informal interview. What experiences shaped your approach to public health, and tell us about some of them that were maybe formative for you.
Sure. Oh my. Formative, each, right? But I'll speak particularly about two and then where I am right now. So Chemonics was my first sort of post-COVID job after doing COVID response work. That's where I got a lot of experience in global health. So working with USAID as a partner, working on sort of program management, right, to make sure that all the money that we were getting from USAID was being stewarded well. The initiatives were also being tracked to completion. So at that time, I was working with, or my team was working with a team in Bangladesh, and they served hundreds of clinics. Also, funny enough, doing maternal and child health. So that experience was really good for me for global health perspective and also for program management. Another one, Ariadne Labs was, one of my most favorite work experiences thus far. That was more domestic health. And there I worked on more chronic diseases. So there was a colorectal cancer safety net, as well as a stroke care project that I worked on. Basically, what safety net means is that the company saw that there were people that were sort of diagnosed with colorectal cancer, but had come in for screenings, right? So something was missing. Either they were missing follow-ups, a reading was off. And what a safety net is meant to do is to catch those, missed patients. So patients that are maybe overdue or that have, one standard deviation off a risk reading, something like that. So that I really saw the strength in not just clinical readings, but they also use patient care navigators, right, to call patients see, just what's up with them, to remind them of appointments, things of that nature. And our writing lab is really where I saw that connection once again with clinical work, and also how public health connects all environmental and social drivers of health to ultimately give patients the access to get their best health. And most recently, it's been about 3 months now, going to be 4 with NACHC, otherwise known as NAC. It stands for National Association of Community Health Centers. I've been doing program management with them as well. It's been a great experience thus far. Our community health centers in the US, I believe, serve 1 in 10 people, which is major and is also a cost saver for the economy as well. When people primarily visit their community health centers, that means they're avoiding EDs, so they're putting less burden there. They're incurring less costs for themselves and the system as well. So while at NAC, it's a very mission-driven organization, which I love, and really working on different programs for both chronic infectious diseases to improve the health of our communities.
Yeah, well, I appreciate you sharing those experiences and the work that you're able to do now. And yes, community health centers are so vital, especially in today's world where things are getting even crazier, unfortunately. So yeah, okay. So kind of getting back, I guess, to both of you all. You all both went to your got your GW. Can you share maybe how y'all met, and then how did that relationship culminate into the HealthWhiz actually coming to life?
I'll touch on that.
Okay.
So we knew each other slightly socially out of GW, but really formally met, funny enough, while looking for roommates in the Virginia area. And after graduation, when I was thinking of who to partner with for HealthWhiz, as Tosin shared, she has a psychology background. I do not. It was my least favorite subject. That is my blind eye, my blind side. So Tosin brings a very rich perspective to HealthWhiz, from designing the box to advertising strategies to how we're wording things. I knew that her unique perspective with that psych background was going to be invaluable to the game. So luckily, post graduation, stayed very close in touch and looped her together to form this team.
Awesome. And I know maybe you already kind of like shared this, but like, what are some of the long-term goals that you would like to see with the HealthWhiz?
Do you want to take it,
I
Tos?
mean, I can go. I know Toby touched a bit on that earlier, but our long-term goal would like be to collaborate with whether it's local health departments or nonprofit organizations, so that the game can be used during like workshops or any community event, whether it's any campaigns going on or conferences for work, like building relationships with larger organizations, from schools to association. And we basically, like, the goal is to expand distribution so that we can amplify the impacts that we make, or amplify our impact. We would love to continue to like partner with teachers, youth organizations. We want them to be able to integrate HealthWhiz into classrooms, hopefully. Health fairs, enrichment programs, after school, homeschool. Yes, we're not letting that out, because even for homeschoolers too, yes, we want to expand into this. The goal, what we see is we want HealthWhiz to be played by almost everyone. Yes. And I guess for now, maybe sometime in the future, we would explore maybe the opportunity of being digital, because that's also like so many questions that we've gotten about the game. Is that, oh, is it online? Can we play it online? So maybe that's something we would work on in the future, and make an app-based version of HealthWhiz, and that could be more widely distributed via remote learning or virtual events. So that is our long-term goal. Yes.
Awesome, awesome. Well, I'm glad that you're able to start here, and I look forward to seeing where you're able to take it going forward. And I'm glad that I've been able to, I guess, connect with you all and learn more about this as you all are building it. What are maybe some of the lessons that you all learned co-founding something together?
We've learned so many. So many. It's like building a plane as you're flying it, I think is sort of an overused term, but it's true because we were building the game, there's also a legal entity. Like HealthWhiz is a business, right? So there was the process of, is it an LLC? Is it an S corp? Should we trademark the logo, trademark the color? How much is going to cost us? We're not making any money. It's going to be an expense. So I think one, the business part of it was very much an iterative process of learning, which I'm glad to have this wonderful partner to do it with. Also, who we were going to bring on, right? We were going to contract a graphic design person. We were going to try to figure things out ourselves, which we did from time to time. And then just, I'd say, an entirely iterative process. The final product that is out right now of 200 words did not start off like that. It was much more. We had to make hard decisions and cut them down, and then decisions of, is this word too difficult, too niche, too easy? Which one should be a guessing? Which one should be a definition? As I mentioned earlier on, we released October 2024. June was the announcement. October started, actually shipping games out. But the idea was birthed in 2021. So this is months and years of working collaboratively together, having discussions, never arguments, of course, to get to this final product. So many lessons in team building, definitely.
Yeah, definitely team building. Even unconsciously, because you have to compromise in certain things.
Right.
There was fact checking. We had to decide. We had to hire too at some point. Interview some people. Do we need to contracting certain workouts? Because a big lesson is that we can't do everything ourselves, and we had to we learned that pretty fast. The people we're going to contract to do this work for us, it was important for us, or important lesson is that we need to compromise, yes, in order to move the work forward, really. So that helped. Yeah.
Still learning.
Like,
Still learning.
I could only imagine. I know how that co-founding work can go, and when they are big personalities with visions and different ideas, it can be challenging as well as so rewarding to get through all those parts and get to a finished product. And I will also commend you all, as we were sharing before the interview started. You all did a lot of this work pre-chat GPT. I could only imagine how much you're looking at that and saying wow, this could have been a resource. But regardless, you're able to get the work done, and I think that goes to show for the people that are out there, you don't need Chat GPT to be able to do cool things out there. So I'm glad that you were able to actually actualize that and show people. So you.
Oh no, I said thank you. I probably didn't say that louder.
No, you're most welcome. You're most welcome. And where can people find the HealthWhiz or support the work?
Yeah.
So yes, you can find HealthWhiz on our website, healthwizgame.com. You can find us on Amazon. If you type out HealthWhiz Game, it would show up. And those are currently where we're selling them. We do pop up every here and there, but you wouldn't know the information. People wouldn't know, but yes, those are the two sites right now where you can go and support us, and also follow us on Instagram and on TikTok too. We share very good videos or fun videos, games. Follow us and support us on Instagram on HealthWhiz game.
Awesome. And I'll be sure to link those below for anyone that is interested. as well. So before we move on to the Furious Five, which is the questions that I ask all guests, I've added in this past week's guest question, which the question to you all is, what's a lesson you had to learn the hard way in public health that you now consider a gift? If anything.
Yeah, I've actually learned many lessons the hard way in public health. I think the first one that comes to mind, going back to what Tosin said about those systems. I think whether you're working in global health, domestic health, you're working with people or clinicians, there's just some systems that have to be in place. There's some contracts have to be in place, some, financial plans, work plans with timelines that have to be in place to move the work along. And it's not exactly the exciting stuff, right? It's not always going to be speaking in focus groups and, the liaising with people. Sometimes it's report writing, it's grant writing sometimes. And, that grunt work is really part of what makes the system move along. So I think a hard lesson is that sometimes that sort of boring work is absolutely necessary for us to ultimately achieve the goals we want to do in public health.
Yeah.
Anything from you, Tosin?
I'm thinking, and I have lessons that we should, I don't know, support public health. I guess maybe support is not the word because I feel like the public is, should I say, not skeptical, well, skeptical about health information. And me working in the health department helped me to see that from the inside. But it was also good, I guess the lesson, it was good that I was on the outside before I got on the inside to see. And I guess the lesson is not everything will always be black and white when it comes to public health or sciencey. And I think that's what people or the communities always like want to, requesting from us in public health. Because from my experience, there's certain situation where I'm talking to either like a patient or like a stakeholder or somebody like we're in partnership with, and I'm saying this is the guidance, this is the policy, this is what we want you to do. And then there's this questioning factor of why and how, and all of the misinformation comes into place. And, the lesson I've also had to learn is to be very clear and tell people what the issue is, and also not necessarily standing your ground, but make it a partnership, like so that it doesn't feel like you're policing, and you're able to still communicate the importance of why this guidance is so important. Because a good example was during COVID-19, people were like, why do we have to isolate? What does this mean? This is not even real. And a way to explain. It was like, oh, you're lying to us. But what people didn't know is that we didn't invent science. So we kind of have to like work along with, scientists. So we're knowing this information, we're passing out this information to you as we're knowing it. And when there's a problem, we'll come back to like tell you there's a problem. But I guess people forget that aspect of this. So I would say again, another lesson is going to be like patience with the public, effective communication, being transparent, because that's very important if we want the public to always take public health serious. And also being out there too. I don't know if all of these are necessarily hard lessons, but they are lessons that I've learned along the way. Is people need to know what we do. Otherwise, it would be very easy to dismiss the work. Right. And we can already see that happening because a lot is going on in public health right now. If people don't know about it, then how are they going to talk about it or support it or even fight for it? Yeah. So, yeah.
No, those are on point. Those are on point. I think all of those are very, very real things that we have to like understand and realize. And especially like in today's world, and the importance of like communicating the importance of public health and what that looks like like it boggles my mind that, like, I don't know, what is it, 5 years after this global pandemic, people still don't know what the importance is, or they say like they say many things that are boggling to my mind. But yes, we definitely need to continue to meet people where they're at, understand their perspective, and like create ways to have conversations so that they can understand and feel more comfortable and confident in public health. So appreciate those definitely. Okay, so moving you all to the Furious Five questions that I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Furious.
I can go. What advice? I would say check the time, the climate, what's going on whenever you're trying to pick a career. In public health, you have to really know your why. I think that's very important, because if you know why you are into it, or why you're doing it, or why you want it, then when there is challenges, you already have your reasons. You know your why, so you would know why it's important for you to stay, because there's going to be challenges. So if you're pursuing public health, you need to know what public health stands for or what it represents. And sometimes public health is like, not even sometimes, it's politicized. You have to understand, what does public health represent, the whole funding, know the pros and cons of it. Be ready, know why you're going into it. Have a goal. That way, when you get yourself into it, you're not that you won't be shaken or you won't be challenged or any other things, but at least you're prepared. You know why you're in public health, whether it's to help, it's whatever it is that was driving you, or whether it's a transition in a way. Because yes, you could also use career in public health to transition into something else.
Yeah.
So my advice would be like, know your why, stay true to yourself, and stay encouraged. Yes.
My advice would be the exact same thing Tosin said. I have no additional notes.
Awesome. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Yeah, I'd say as a program manager, it's definitely, I think maybe while we were in the master's program, it was maybe advertised as a entry level position. It is not. To be a program manager, I've gotten here, as you mentioned earlier, Omari, like with the other previous work experiences, by working in different roles in an organization, right? So as a PM, you're meant to have full scope of everything going on with the project, keep track of things, and keep you all on track from start to the finish line. So the advice I would give someone looking to be a PM is to, in your professional journey, take on different roles, take initiative, be proactive with different projects and different tasks to really get a feel of all the things that go into making a program or project successful before then wanting to land at a. So really, just be involved in different experiences and different roles thoughtfully.
Yeah, I would say for me, if anyone trying to get into the field of epidemiology, I think there are programs now that you can either specialize, or like you can do the focus track in epidemiology. And if you're not doing that too, that's fine. It doesn't mean you can't get into it. You just have to make sure that you have the skill sets. And you can get those by taking courses, additional courses, or while you're in your program, take some like SAS, Tableau, all of this data analysis skills that could make you stand out too. Like if you want to you're competing with other people too. So take all of this important data classes that will help you do your work efficiently, because be confident. A lot of the work of an epi is doing investigation, disease trend data analysis, looking at trends, data, all of that. So you would have to make sure that you have the skill set. So if you come prepared having it, then you're good to go. Yes. And most of the work, you just like other things. You learn on the how to talk to people or investigation. I didn't learn investigation in school, but I had an idea. I've done like trainings. I took a certification in case investigation from John Hopkins. So always look for ways to stand out.
Yeah.
And, yeah.
Number 3, what's something you all are working and improving in your lives right now?
Diet / nutrition diet.
Yeah.
Yes.
I would second that. It's health. Yes, because it's 2025. You have to stay on top of it. Yes.
Absolutely.
Yes, that's definitely where I'm working at. Staying healthy in general, not just, diet. And that does not have to always include food. Is the things that everything around you, just be aware. Walking, you know, physical activities, those, yeah. So I'm definitely improving on that. What else? I'm always looking for ways to improve, yes, but that would be mainly it.
Love it, love it, love it. Number 4, professionally, do you recommend anything outside of the HealthWhiz board game?
So a show I love to watch is Shark Tank. I love Shark Tank. That one's most relevant to, everyone actually, everyone. Another one I would say I'm not a big podcaster, but I will listen to like an NPR episode. Book most recently read When Women Lead. I forgot who the author is, but it's like a blue and red cover about women who are, CEOs, CFOs, leading startups, etc. Um,
I can't really think specifically of anything. It could What book am I currently reading? One of the podcasts that I love is the Entrepreneur. What Now?
Mhm.
I think that he always have like interesting topics and hosts that he brings. So those are kind of outside of distraction, outside of work, and also wanting to be in tune with what is going on around. So I recommend that because there's so many interesting topics that he talks about and interesting people he brings on. Book, I would say I'm currently reading Be Ready When the Lock Happens. And it just like speaks about just being not giving up on yourself, basically. I haven't finished reading the book, but it's an interesting story. Yeah.
Awesome, awesome. Well, thank you. Yeah, I enjoy that Trevor Noah podcast as well, and I feel like you also gave some good recommendations on the question above about like courses. Make sure that like you're doing things to set yourself apart as well. So refer to that question or the answer to that question as well. Everyone that's listening, and then last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
do you want to go?
Yeah. Piece of advice, I would say just do it. Do it fearfully, even when you're afraid, because it's also like it's a sign. I feel like a lot of the things that a lot of us don't do is out of fear. Let me personalize it. A lot of things I don't do is out of fear, but it doesn't mean I can't do it. It's just, and that probably affected me more, you know, when I was younger. So I would tell my younger self to just stay the course, just do it, whatever you want to do. Yes. And learn from it, even if it ends up not being, yes.
I would tell my younger self to be patient and present. I think something we all face, maybe when we're in a place we don't think we're meant to be, or we're behind, or we're just maybe not comfortable with where we are, is that you don't really sit in those experiences and say, what can I learn from this, right? You don't shift your perspective to one of positivity. And so I tell my younger self to be patient and be very present. What stage I was career-wise, if I was in transit, unemployed, not employed, taking classes, not taking classes, just say, how can I look at the situation and make it positive, like put a positive perspective on it. Yeah.
Love that. Love that. Well, Tobi and Tosin, thank you all so much for coming on, sharing your insights, sharing more about your game, the Health Whiz, and look forward to continuing to stay connected and to continue to learn from you all. And let me know if there's any way that I can continue to support.
Thank you so
Thank you
much,
so
Omari.
much. Thank you, Omari.
Truly, truly is my pleasure, you all. Housekeeping items, everyone. Thanks so much for watching and listening to this. Be sure to subscribe if you have not as yet. Share with a friend, leave a like button, and also leave a review. That really helps the show get out to more people and let people know that this is a great show to listen to. So do all those things. See you all next week. Peace, everyone.
Bye.